We do a lot of core work and work with a lot of pre and postpartum women. And one important thing to remember when you are trying to rehab your core is that we want to give a nice increase in load, stressing that area so that it makes it stronger, but we don't want to go a little bit too far where we start to have coning or doming happening, because that means you've gone just a little bit too far and it might make your core problem worse. And coning and doming is a sign that it's making your diastasis recti worse. So that would be the separation of the abdominal wall right in the center of like the six-pack muscles or the rectus abdominis. So often when you're pregnant, we get a separation along this center line here. It goes from the bottom of the sternum to the pubic bone, and people often get it, at the end of pregnancy. Sometimes it heals itself naturally, other times it does not. Most babies are born with a diastasis and they heal theirs naturally because they're smarter than us and they move better than us and they breathe diaphragmatically and they learn to crawl properly and they use their core bracing system, and then that slowly heals their diastasis naturally on their own. So we try to imitate what they do and heal yours the same way a baby would. Now, you don't only get this from pregnancy, you can get it from lifting too heavy, rapid weight gain, that kind of thing. I had an upper diastasis before I had kids from being really into fitness and doing a ton of core work that was asymmetrical and caused some separation up here. And I can make it go away by proper bracing. And it's pretty manageable. If you don't take care of a diastasis issue, and I see this a lot in men too that have either done a lot of lifting, either whether it be in the gym or hobby or work related, if you don't take care of it, it's going to leave you open to low back pain, SI joint pain, hip pain, because you're not able to manage your core pressure well, and then it affects how we move and lift things. So when you're doing your core exercises, any core exercises we have on here, you always want to check in to see, do I have coning or doming? And that would be anywhere along that center line from sternum to pubic bone would be a little humped up area. So I always am noticing it on patients when they go to lay down on my table at the office or get back up off my table. So if you're going to lay down on a chiropractor's office, you sit on it and then you kind of like lay yourself back, and I can see it right through your t-shirt. It's really easy to see. So as you're lying back, right in through here, people don't tend to roll, and it will poke up right in through there as they lie back. I also, if somebody has like a looser sweater on and I want to retest it, I'll have them lift their head and try to sit up, and I'll check for it there, and then I'll palpate right down the center. So now when I am not using my bracing and I'm letting my ribs flare out to the sides, I can let my fingers will dip down into that center line. Now, if I lower my head, rest, inhale, and then exhale, I'm bracing, I've got my ribs together, I lift, that squishiness is gone. So I can approximate those edges of the muscles together by proper bracing when I go to do it. When it is in a vulnerable state for me is when my ribs are wide and not tethered down. And different muscles will do that for you. But a good way to check, like if you're doing dead bug and you've got your legs up in the air, you can put your hand on your stomach. You can do the breath cues, and then as you lower one leg, you're feeling along here. Is this getting domed? Is it getting squishy? That's going to tell us we've gone a little bit too far and we might need to back off and use a little less intensity. And when somebody is pregnant, I always remind them, instead of having them just lay back, them lie onto their side, come onto their shoulder and roll out. Same thing for if they're getting in and out of bed. I want them to roll to their side and sit up this way, because if you have that doming and you keep doing it, when you have that thing popping up in the center of your stomach, it's going to tear and tear and tear and make it worse, and it's not going to give itself a chance to heal. So be conscious. It doesn't even have to be lying on your back. It could be in side plank. It could be, often it happens like when you're trying to lay down on a table. It can happen if you're doing hinge backs. You can feel here. If you hinge back, if I don't have my ribs tethered down, it pokes out a little bit here. If I come back, reset, draw the ribs in, then I hinge back, it firms right up. So it doesn't even have to be lying on the ground kind of ab work. It can be any position you get in might be a little more or less vulnerable for you. So check in, make sure that that's not happening, because that will make it worse and not give it a chance to heal.